People who struggle with addiction have a bad rap, and for good reasons. At the height of their addiction, many resort to unsavory behaviors that can be hurtful to themselves, their loved ones, and society. So it's not surprising that many people are appalled by this behavior and don't want to have any association with people who struggle like that. But there's a difference between choosing to distance yourself from someone in active addiction and opposing the idea of offering treatment and support to people who need it. In this video, I want to take a look at some of the arguments of why we should invest in helping people with addiction and why treatment services matter. And we will go through both more philosophical angles and my opinions, as well as some arguments and facts. But why do we even need to have this discussion? Well, for one, there are people who are strictly against providing services to people struggling with addiction. And sure, who cares what your Uncle Jeff thinks? He's gonna ruin Thanksgiving dinner anyway. But it's not just a question of small conversations here and there. It's a public health problem, and as such, we have to talk about it. Do we, as a society, want programs for people who struggle with drugs? If so, who is going to be responsible for them? Where and how will they get funding? What skills and certifications should we expect of people who work there? All of these are important questions. But before we can answer any of them, we have to start with the most basic one. Why should we even help people struggling with addiction? The human angle. First of all, people who struggle with substance use and abuse are human beings. That might sound obvious, but addiction is one of the most stigmatized conditions in our society. People with addiction are often dehumanized. They face discrimination and are seen as less capable of feeling, thinking clearly, or making good decisions, as if they're somehow less valuable, less deserving. This, of course, is not true. We cannot put a price on someone's life. People do not stop being people simply because they chose a different path in life from what you understand and what you choose for yourself. In this dehumanization mindset, it's easy to stop seeing people and start seeing problems, something we need to get rid of as quietly and cleanly as possible. But when we stop seeing people, we stop feeling empathy. Addiction is often linked to negative traits such as laziness, weakness, danger, selfishness, or irresponsibility. It's rare that we look at someone with addiction and see someone who's lost, hurting, or scared. Especially since people who do drugs often enjoy the high, have a love-hate relationship with the drug, and refuse to repent and play by your rules. There are political and historical reasons why we tend to see certain groups, including drug users, as something beneath the normal person. Many groups were marginalized because it suited someone in power, or they could be used as scapegoats or as a distraction from other problems. But I'd say it's time to leave this in the past and approach all people with more understanding and less judgment. That doesn't just help people with addiction, it helps create a safer, more humane world for everyone. The free will angle. When talking about people who struggle with substance use, we have to acknowledge that the stigma has many levels. Not everyone has the same options in life, and different groups are marginalized at different levels. A white college student who uses cocaine at parties will be seen differently from the same person in the same situation, but a person of color or someone who is not educated or doesn't have a home. There are layers to who is allowed to be a victim of their own circumstances, upbringing, and biology, and who is just a dirty drug addict who should try harder. This creates a false sense of who deserves help, who is to blame for addiction, who chose their path, and who was a victim. Addiction etiology is complicated. Addiction does not have a single cause. It can stem from genetics, trauma, environment, mental health, or just because drugs are fun, at least in the beginning, or a combination of all of these. There are many roads to addiction, but some roads carry less stigma than others. But even the reasons behind someone's addiction are judged unequally. Losing the genetic lottery might be seen as more forgivable than using to cope with trauma. Getting addicted after a doctor's prescription feels more legitimate than using the same drug bought on the black market. Being addicted to legal drugs is preferable to being addicted to illicit drugs, even though just because something is not legal does not mean it's more or less dangerous than some legal substances. Is addiction a personal or social failure? A moral weakness? Is the damage self-inflicted? And do addicted people deserve to suffer for it? These models help us understand the complexity, but they don't always change how people feel about addiction. Many people still see addiction as nothing more than a failure of willpower. That if someone can't quit, it's just because they're not trying hard enough. And on the other side of the spectrum, there are people who do not believe in free will, and as such, why would you invest time and energy and finances in supporting people who cannot change? To me, it feels unfair. Beneath all you can see, there is a person who needs and sometimes wants help. To deny them such help is cruel, regardless of who is to blame, of what started it. Which brings me to my next point, the medical angle. Let's talk about addiction as a medical condition, because that's what it is. Substance use disorder is officially recognized in the DSM-5. It has diagnostic criteria such as loss of control over the substance, cravings, tolerance, withdrawal symptoms, or continued use in spite of negative consequences. Despite this, many treatment centers operate on a system that doesn't reflect this medical understanding. Programs often require strict abstinence and might end service if the patient relapses. At the same time, the patient was admitted to the program based on the fact that they struggle with substance use. It feels almost counterintuitive to discharge someone for showing symptoms of the very condition they came in to treat. And I understand the need for structure and safety. I understand that the patient failed to comply with the treatment plan. I'm just asking whether it is reasonable or even ethical to expect patients to never relapse. We know relapse is a part of recovery, and many people need several cycles before they can succeed. And I'm not talking about a situation where the patient fails to comply frequently, is disruptive or dangerous for the group, or simply unwilling to engage with the treatment plan. But in many places, relapse is not treated on a case-to-case basis. It's just black and white. If any screened drug shows up in a urine test, you're out without any further discussions. Even if you want to continue in treatment, even if you slipped for the first time. In many cases, this feels punitive, and as healthcare professionals, I don't think it's our place to punish patients. It can be harmful to sever the patient from pro-recovery networks, often without offering alternatives. No follow-ups, no peer support, no professional support. Goodbye and good luck, you're on your own. But really, is the patient failing the treatment, or is the treatment failing the patient? Finances and public health. And even if you don't give a rat's ass about drug users' lives, maybe there are other angles to addiction treatment you could get behind. Most people care about something like safer neighborhoods, public health, or how we spend public funds. Because when it comes to addiction services, especially funding addiction services, people are quick to object. After all, it can seem like all these programs do is enable the addict to continue their harmful behavior or even condone it, especially when it comes to low-threshold treatment services and outreach programs or syringe exchange programs, and that tax dollars are wasted on people who do not deserve it. But the truth is, addiction places a massive financial burden on society. Substance abuse is associated with many costs. Some costs are easy to see, like emergency room visits, hospitalizations, and social services. Others are less obvious, like lost productivity, unemployment, homelessness, and family disruption. And then there's the criminal justice system, arrests, trials, incarceration. All of it adds up. Providing services for people with addiction isn't just ethical, it's also financially responsible. When comparing the numbers, Providing treatment is cost effective. It saves money in the long run. This is consistent across various types of services: prevention, early intervention, medication-assisted treatment, needle exchange programs, even supervised consumption sites. All reduce downstream costs dramatically. The area that seems to benefit most, at least in the US, is criminal justice. When people get access to treatment instead of jail, they're less likely to reoffend, more likely to stabilize, and far more likely to contribute to society again. And life isn't just about money. These services also improve public health for everyone. Needle exchange programs and supervised use sites can help reduce the spread of infectious diseases like HIV and hepatitis. They also prevent fatal overdoses by providing a safe environment and access to naloxone. Harm reduction programs connect people to housing, mental health care, and other medical services they might otherwise avoid. And that's not just good for them, it's good for communities. It means fewer emergencies, fewer disease outbreaks, and less strain on public hospitals and first responders. In short, every dollar spent on addiction treatment saves several down the line. And unlike punishment, treatment creates the possibility of real, lasting change. I think there's still this idea that people have to deserve help. That if you're addicted, you need to prove you're worthy of care. That you have to jump through hoops before the system will take you seriously. But is help really something people should have to earn? That's not how we treat other health conditions, and honestly, it's not very helpful. The world can be a cruel place, but it doesn't have to be. Unlike one small act of kindness, treating addiction is not free. But that doesn't mean we shouldn't do it.